You're listening to a podcast from Cancer.net. This cancer information website is produced by the American Society of Clinical Oncology, known as ASCO, the world's leading professional organization for doctors that care for people with cancer. Our topic today is what to expect when you have a Pap test. Doctors use a Pap test, also called a Pap smear, to check for abnormal cells in the cervix, which is part of a woman's reproductive system. The cervix is the part of the uterus that opens to the vagina. During this podcast, you'll receive an explanation of what happens during a Pap test to help you prepare for your own test. You will also be offered a list of questions to discuss with your doctor about your test and its results. A Pap test is usually performed as a routine screening test for cervical cancer in women who have no symptoms. It is typically done as part of a gynecological checkup. A Pap test can detect cervical cancer as well as early changes in the cells that, if not treated, could turn into cancer. In fact, most Pap test results that find a problem are related to these early cellular changes rather than cervical cancer. When cells are treated at this precancerous stage, there is an almost 100% chance of curing the problem. A Pap test takes place in a private examination room in your doctor's office, generally with a gynecologist performing the test. A gynecologist is a doctor that specializes in women's reproductive health. If your gynecologist is a man, a female nurse or assistant will be in the room during the examination and Pap test. Other health professionals who can perform a Pap test include physician assistants and nurse practitioners. When scheduling your gynecological checkup, make sure the appointment is at least 5 days after the end of your menstrual period. Also, don't have sexual intercourse for 2 or 3 days before the appointment, and during that time, don't use any products that would be inserted into your vagina. Avoid tampons and vaginal foams, medicines, douches, creams, or powders. These steps will help ensure that the Pap test results are as clear as possible. When you arrive at the doctor's office on the day of the test, you may be asked such health-related questions as whether you are pregnant, whether you use birth control and what type, what medications you've recently taken, if you smoke, and whether previous Pap tests have ever found a problem. You will also be asked about the date and length of your last menstrual period, whether you are experiencing any problems, such as redness or itching, and if you've had any surgery on your reproductive system. When you enter the examination room for the Pap test, you will be asked to undress from the waist down and be given a sheet to cover your lower body. You'll lie down on your back on an examination table, raising your legs and putting your heels in stirrups at the end of the table. You can keep your socks on to keep your feet warm. The doctor will carefully insert a lubricated instrument called a speculum into your vagina. As it gently spreads the vaginal walls apart, you may feel some discomfort. Breathe deeply and relax your muscles to help relieve the discomfort. The doctor then visually examines the cervix through the speculum. With a cotton swab or other small instrument, some cervical cells will be collected from 2 places in the cervix. During this collection, you may feel a slight pressure. The swab and speculum will then be removed. The cells will be smeared onto a slide or stored in a container for shipment to a lab, where another doctor, called a pathologist, will study them for any abnormalities. The Pap test itself takes just a few minutes. It can be uncomfortable but seldom causes any pain. Having an empty bladder may help you feel more comfortable during the examination. After the Pap test, the doctor will often perform a pelvic exam. He or she will gently insert 2 lubricated gloved fingers inside your vagina and use the other hand from the outside to feel for lumps or tenderness in your reproductive organs, including your ovaries and uterus. When the examination is complete, you may have some vaginal bleeding. This is normal, but be sure to report any heavy bleeding to your doctor. You can resume all your normal activities, including driving, after the examination. The Pap test is an excellent medical tool, but not perfect. Sometimes results come back normal, although abnormal cells are present. For this reason, it's important to have Pap tests regularly, at least every 3 years. Research shows that almost all cervical abnormalities can be found with regular screening and treated before they become cancerous. Before your Pap test, consider asking your doctor the following questions, along with discussing any concerns you may have about the test. Question 1. Who will perform the test? Question 2. When and how will I get results? Who will explain the results to me? Question 3. What happens next if the results indicate a problem? Question 4. After this test, when should I schedule another Pap test? Question 5. If I have had the cervical cancer vaccine, also called the HPV vaccine, do I still need regular Pap tests? Knowing what to expect before having a Pap test will hopefully make you more comfortable with having this important test that can provide value information to your doctor about your health. For more information on this topic, contact your doctor or visit www.cancer.net. Thank you for listening to this Cancer.net podcast.